The latest figures show the Western Cape to have 4,916 cases. With 7 deaths overnight, the death toll is now 95. But a return to level 5 of the lockdown is not on the cards.
We have not discussed anyone who goes to which level, but we are saying people must not be surprised. There's not going to be one size fit all here. We're going to have a situation where, based on the challenges and the level of transmission and the risk to the community, certain restrictions will be imposed that might be equal to whatever level of a restriction.
There's no discussion of going to level 5, although I have heard certain people calling for it. Obviously it is a tool and a lever that you can use, but our discussion was, how do we have a look at those hotspots? And so what we're doing is focusing on the hotspots and management tools around the hotspots.
The province has had what is called a cluster outbreak in certain areas. This and the early onset of local transmissions are what led to the high numbers. Other than this, the province is not doing anything differently.
We've got the predominance of cluster outbreaks. Cluster outbreaks are happening in commercial settings, in factories and retail shops.
Mkhize says he has been given a proper picture of the situation in the Western Cape by authorities here and epidemiologists. He lauded the Western Cape government for its case management, but said more focus needed to be placed on strengthening the quarantine process. The minister said national and provincial departments were working together to slow the spread of the virus. President Cyril Ramaphosa is expected to visit the province next week. Abra Barbia, SABC News, Cape Town.